When we think of heart health, we often think of adults, but over 70% of American children have poor heart health, according to the American Heart Association.
Joining us this morning from Gunderson Health System to discuss is Andrea Winters. Good morning, Andrea.
Good morning. Thank you for having me.
Thanks for being here. And as we've said, 70% of American children have poor heart health, but that number may actually be higher.
Yeah, it's disturbing. This is a study that was done over a 6-year period looking at nearly 10,000 children, and it based on their age range calculated what their predicted heart health as into adulthood would be. And the higher the score, and the score is based on 8 factors that we can control about our lifestyle, the higher the score, the more likely they could have long-term heart health. Many kids scored very low, unfortunately, and even in the 12 to 19-year-old age group, it was only 14% scored in that range that said they were less likely to have premature cardiovascular health. So it's kind of disturbing information.
And Andrea, how can you tell if your child has poor heart health?
Well, it's lifestyle is the biggest factor with this data, and so bringing them in for the routine care is really important, because that's where we're going to screen for some of those silent threats that might not be apparent in children, like their blood pressure and their cholesterol levels and their blood sugar levels, which can be surprisingly high for children, even children that you wouldn't necessarily think could be the factor because of some genetic part of this too. But I would say too, it's just really about that modeling of good health, of bringing them in and being seen regularly and encouraging them to learn, be lifelong learners about good nutrition and physical activity, and modeling that behavior as a family.
Well, Andrea, we really appreciate you taking some time to chat about this morning.
Thank you for having me in Heart Month. Have a good day.
Bye now.